Howdy, everyone. Matt here. Matt the PT coming at you again with another thing that I have pondered for quite a while. It's based on something I've experienced, I've seen in my practice over the years. I've talked with other PTs and PTAs. I always mean to include PTAs in whenever I talk about this because we're all therapists. We all work with patients. And that is the thing that we as PTs and PTAs, or the profession in general, is seen as something that is soft, that we're too passive. We're just too, we're not tough enough on people. And that's why people don't respect us as a profession. Now you may be saying, that's not me, Matt. That's not me. I'm tough and hey, that's perfect. That's how, hey, and I would say, by and large, many of us say we are. We are. But I'm saying that's the view that people have of us at times. And why I think that is, I think there's a couple things that go into it. There's a really big one I'll talk about here in a minute. But I think a part of it is that we want everyone to like us. I'm not saying that's bad. I am not saying it's bad that your patients like you, that they're happy to come see you, that they have an enjoyable experience with you. I'm not saying that at all, because I do feel that does need to be something that is experienced with patients, that patients that are coming to see us are very often at a very low point in their life. They're dealing with an injury, they're dealing with a pain, there's some kind of limitation, something that's going on that's negatively affecting their life. And they're coming to us, and so that we should make this experience, as pleasurable as, or as happy, as good as we can make it be to get them to that goal. And so they look back and they think about like, oh wow, like yes, this is a very, very good experience. But does that come again at the expense of us trying to make sure that every patient, every person that comes in, everyone that we deal with likes us? And again, I would say this as a person that, we should be nice people, that the majority of people around you should like you, your neighbors, your friends, the people that you interact with. Yeah. Yes. But I would say really looking at this when we start as therapists, when we start on our first clinical rotation, think about that as a student. You go out, you want your CI to like you, that you do well, so that you pass your clinical rotation. And part of that too is so that your CI likes you, that the patients need to like you. So, you don't want to ruffle feathers. You don't want to push people too hard. You want to make it, again, that very pleasurable, nice experience so that everybody, again, likes you, so that you pass. And I believe this continues to carry on as we go. And again, I say all my patients, that whenever I work with them, I want them to like me, to say, yes, I like going and seeing Matt because he's going to help me. He's going to be nice. He's going to be friendly. He's going to listen to me, all of those things. But I think a part of that too is that there is a difference in how everyone involved with that rehab is viewing a positive experience. So I'd say we as therapists, we view a good therapy session, a positive therapy session, is that the patient makes progress. That you come in, hey, that you're moving better, that you're stronger, that you can do, this activity this many times compared to the fewer times that you did last time. That you had some progression there. But I think as well with patients that they view it differently. Every patient's going to view it differently. They may not view that a good session is that they made progress. That hey, I did 10 repetitions last time, now I did 15, or I did more weight, or my range of motion was better. Do many of them view that as a good positive experience? Or do they view it as man, they worked me so hard? And there's people that do that. I mean, look at exercising, people like, I had a good workout session when they came out like sore and like drenched in sweat, and they're just like, oh, I can like barely make it to my car. So some people may view that as like, oh, that was a good, a good PT session. Or somebody else may view it as like, I got a lot of feel good stuff. I came in, how people view it. It's like, I came in, they put me on the hot pack and they rubbed me. I did the traction thing or the stretchy thing. They did a lot of passive stuff with me. And I just felt so good when I left. And so is it that everybody has a different vision of what a good therapy session is? And then that starts conflicting, because if we as a therapist don't line up to their view of that good session, does that mean they don't like us? Because we're not taking that into consideration. Now, I do believe that there is a component of that we are the experts in it. That's what it's what we tell us, what we were taught. That we know how to help you. We know how to get you better. We know how to do those things. So the things that we need to do may not line up with what you think that you need or that you want. So again, that person is saying, well, I want just like hot packs and stretching and massages just to feel better, when you realize like, no, you need to be up and exercising and moving and lifting. Like, yes, there's going to be discomfort, but it's going to help you overall. And then that just kind of clashes. Or again, that person that has a session when they're just like, you just beat me up. I just want to push through all this and get past this. And you realize like, no, you don't need that aggressive stuff right now, because maybe you just had a surgery. Maybe you're very acute. Hey, we don't need to do those things right now. We need to back you off and stay at this lower level for just a little bit. Like we know how that happens. And so then that messes with people's, perception of it, and they get mad at us. Now, I think that also carries over to this next thing. And I think this is the biggest thing, is that often we're not supported or backed by people. And the people I'm talking about are like insurance case managers and adjusters, the doctors, the referral sources, and one another, especially our managers, that we're not backed by these things. So talking about, again, we want to please people and keep people happy. So that how often are we trying to keep like a doctor happy on doing the things that they want us to do? I've had patients, doctors send me notes on the referral to like the hum treatment, hot pack ultrasound massage. They send that, or like this like shoulder. One doc, he would always send these like 5 exercises he would write on the form. And you realize sometimes with people like, they don't really need to do this. This is not going to help them. Why are they coming in if that's all you wanted to do? But then if you don't do that, because like I have to do that to keep you happy, even though it's at the patient's, expense, that they're not going to make the progress that they needed, but I'm just doing that to make you happy. And if I come to you to say, no, this is not what this person needs or wants, and that they don't say, hey, you don't back you up, you do what I say. Also, it kind of goes in that point of like, when somebody says something negative about their PT or PTA to, again, that case manager or that doctor, it's this crazy thing that happens. Like, they will automatically believe that person. I have had that happen to me so many times. I've heard this. You probably experienced it too. But why they automatically believe everything out of that person, when this is also that doctor, that case manager, are also the same person that if their patient or client was saying like, oh, I can't go to work because my pain is so bad and I need all this and I need to be off work for 6 weeks and I need all this, and that they would be like, yeah, they're just exaggerating that. That they wouldn't believe them in that case. Or if they found out that patient was talking bad about them, mentioning something that, they don't know what they're talking about, that they would just blow them off. But so the interesting thing is that same group of people would dismiss that patient if it was something towards them. But if it goes the other way and it's about us, they believe every little bit of it. That is something. Then again, it's like, okay, we made them mad because we did this thing with the patient, and they never, hey, did they ever come and talk to us about what happened, and said what happened with this person, and why are they saying this stuff? No, it's just automatically, I'm just going to believe that on it. I'll give an example. I had a physician one time that was down the road from us, and we would get this very specific insurance that would require a pre-authorization, and patient had went to this doc, saw the doc, apparently had given the patient a referral to come talk to us, had never emailed it, faxed it, or anything to us. Patient went back in and said, oh, they told me they couldn't see me because I had to have some piece of paper or something. And he got so mad. Why you couldn't get that patient? And it was like, wait a minute, buddy. That person never came through our door. They never called us. They never emailed. They never came in. And why would we do it? We have not done that at any point in seeing any patient you refer to. We've never done that. Why would we all of a sudden start doing that? And it did change his tone a little bit. So that's the thing. And I also feel like this carries over hugely to one another. So we as therapists, to our peers, and especially to management. And I think this is where the biggest thing about why we are viewed as being soft or passive, it's because there are far too often times when our managers don't support us. And again, it comes down to that if a patient has a bad experience or their therapy session doesn't line up with what they believe it should be, and they complain to them, and then the manager comes down to you to say, no, you need to do all this stuff with this person. And it's like, that's not what they need. No, you need to give in and to do everything that they want so that they stay happy, so they keep coming back. Then what's that do to us as as a staff therapist? Well, now, okay, I may not give that person what they need. I give them what they want. And does that always turn out that it helps them, that they get better? Because I'm just giving those things that they need. And it can end up to a tricky thing. Because again, I can't give them what they need because they don't want it. They want the stuff that they want. Well, the stuff that they want is not the stuff that they need, and they don't get better. So then they're upset. Well, I didn't get better. Well, you handcuffed me because you told me to give them everything they needed, what they wanted instead of what they needed. Now, I am also not saying that we don't take what a patient's, beliefs and wants and all those things into consideration. That's a component to it. And that is something that we do need to talk about with patients. That again, if a patient just wants all the passive stuff, okay, hey, maybe we explain why we don't need that. Maybe we can use it at certain times to decrease irritability or stuff like that. We can use it, but it's not going to be the whole treatment. And I will say, I've had this happen several times with managers. I've worked under many different ones. I don't switch jobs all that often. I've just, usually the upper management people cycle through at times. But I've had great managers and I've had poor ones. And the thing that really separated them was how they handled my ability to treat patients and when patients disagreed on that. Because I'm going to try to give you as a patient the best treatment. And it may not be the things that you want. And I'm going to do my darndest to explain it to you and let you know why. That's what I'm going to do. I'm going to do that. But sometimes people, they don't want to hear that and they want to complain. And the good managers, the thing that they did, they came to me. Hey, Matt, what happened with Mr. So-and-so? What happened with them? They listened to me on it. They read the notes. That manager had also been spending time with me and knew how I was, knew how I am, and would see if there was inconsistencies. Like, okay, that doesn't sound like something that you do. Okay, I understand that. And they didn't scold me on it. Now, on the flip side, I have had managers that somebody complained about something about me, and I've had them straight up not tell the truth, made up things That manager never asked me what happened. They didn't look through the notes, nothing. And they wanted to reprimand me on it. And it's like, wait a minute, I'm trying to do the best thing that I can. And because because I'm not going to just give in, because this is not what they need, and I have explained it and we talked about it and all that, you're punishing me. And you never came to me and you never spoke to me about it. And you've noticed like hundreds of other patients have never said anything negative about me. And you're going to believe that one over there that just, and I can see how this, again, over time, if you have somebody, a manager just beating you down to do this thing and do this and give in, what are you going to do? You're just going to give in more and more and be more and more passive, where I'm not going to rock the boat. I'm just going to play it cool where everybody's just good. And, you know, and I do feel that is detrimental to the overall ability to help somebody. That sometimes we do have to be tough. Sometimes we have to tell people no. We have to tell people the truth. And sometimes the truth really hurts. I had a mental health therapist tell me that. They said, when you tell somebody the truth can hurt, but you can't deny the truth. So whatever that truth is, you can't argue, because you can't, it's not a lie that you get caught. You know, when you tell somebody a lie and they get upset because you lied to them, it's like, no, I told you the truth. And I told you that. And you can be upset about it, but it's the truth. You can't argue against that. So that's what I think about how it is. That part of it is we want to be big people pleasers. But hey, nothing wrong with that. We want everyone to be happy. We want people to like us. You want people to like you so they come back and so that you can keep helping them, which is great. And then they tell more people and you can help more people. But I also feel like the big thing is that we're not supported by other people in the profession. So physicians, referral sources, case managers, especially management in PT, the directors, the regional managers, the state managers, vice presidents and all that. And if that is one of you, if you are a director or the management of a PT clinic company or whatnot, and somebody complains about one of your therapists to you, flip the roles. Think about if you were that therapist and that therapist that you're talking about was in the management over you. How would you want them to come and talk to you? Would you want them to talk to you, or like, nope, I'm not going to take anything that you say into consideration. I'm just going to 100% believe whatever is over here and just reprimand you for it? Probably wouldn't like that. And I would tell every therapist out there as well, when you interview for a new job, ask the manager, so what is the process if somebody issues a complaint about me? What is that process? So say like a patient comes to you to say, I was working with so-and-so and they did blank, or they made me hurt, or they just did this. What is your process? And just dead straight ask them. And so you can use that. So again, if they tell you, oh, we're going to come to you and talk, and if they don't do that, bring it up, or you can get it in writing. This is what the process is. Okay. So if they don't do that, you can bring it up. Hey, you told me in the interview that, and I got it in writing here, this is the process that you go about, and you didn't do that. And that's going to void some trust. And I think that's what also happens as well. It voids trust with us as therapists, with management, when those people don't back us up. And again, it hurts the profession overall. So I'm sorry, I probably rambled a little bit there on that. But again, I feel like, again, to help the profession, that we do need to be backed by our peers and other people in healthcare, that our decisions are what the patient needs. And we do take into consideration what patients, physicians, anyone else, taking that into consideration is not a bad thing as well. And that's important to do. But having that support what can help make us stronger. So let me know what you think. Let me know what you think. I'm not saying that we're going to be tough and mean, that we need to be like that, like drill sergeants and just screaming and yelling. I don't say that at all. We want people to like, I want all my patients, well, I'm not going to say all. A lot of patients like me. A lot of patients like me because I'm funny and I try to be as helpful as I can. Granted, overall, not everyone's going to like you. I say this kind of just in general. You know, some people, we just have a personality clash. That's okay. And I let people know. I'm like, hey, if your personality and my personality don't fit, let's find you someone who does fit, because you're going to end up doing better overall. But like I said, that's what I feel like is kind of giving that perception that we're not backed, and so that we have to give, so then it can just hurt that treatment down overall. So let me know what you think. Let me know. Drop some comments down below. Let's get a discussion going and see what you think about it. So there you go, everyone. Thank you so much for listening. If you liked it, hit the thumbs up. And of course, hit the subscribe button to get all this content as soon as possible. And of course, I'm always looking at things to talk about, and I hope to be able to talk to some people here soon. So take care of yourself, and until next time.